Beta blockers are among the most prescribed antihypertensives in the world, and that is why every nurse must know how they work, the side effects, when to give them, and when to withhold. It is evident that most clinicians administer this medication without knowing its impact on heart rate, blood pressure, and even respiration. But not to worry, in this video you'll be learning about beta blockers, how they work, the side effects, and when to give this medication and when to withhold it, so that we're going to achieve optimized patient outcomes. So now let's dive into the beta blockers. That is the reason for this video. But then, before we go into beta blockers, let's know what the beta adrenergic receptors are. The beta adrenergic receptors are the receptors that are in the body, and these receptors are the points where these catecholamines act. The catecholamines I mean here are the adrenaline and the noradrenaline. When these hormones are secreted, they act on these beta receptors. We have two types of beta receptors. We have the beta 1 receptors and the beta 2 receptors. The beta 1 receptors are found in the heart, while the beta 2 receptors are found in the lungs. See, you don't need to confuse yourself about the difference between beta 1 and beta 2 receptors, because beta 1 receptor, think about one heart. The beta 1 receptors are found in the heart. And then the beta 2 receptors, think about two lungs. The beta 2 receptors are found in the lungs. Now, let's see what happens when these receptors are stimulated. The beta 1 receptors, remember that I said it is found in the heart. When it is stimulated, it increases the contractility of the heart and also increases heart rate and blood pressure. It can also increase the rate of electrical conduction in the heart. Now, going over to beta 2 receptors, which are found in the lungs. When these receptors are stimulated, it causes bronchodilation and vasodilation in the lungs. So imagine when you block the beta receptors in the lungs, it's going to cause bronchoconstriction, and that is why you have to take extra care when administering this medication to asthmatic patients. In fact, you may not want to administer this medication to them at all, because it could have severe side effects which you don't want for your patients. Now, when you block the beta 1 receptors in the heart, it's going to reduce the cardiac contractility, that's the force of contraction of the heart rate, and also the blood pressure. Remember, the main aim for administering beta blockers is to reduce blood pressure, because it is a typical antihypertensive. As nurses studying about any medication, it is very important that we know the mechanism of action of every medication that we are taking. So now let's see how these beta blockers work. There are different ways in which these beta blockers work, so we're going to highlight them. The first one here is that it reduces cardiac stimulation, thereby reducing the contractility of the heart, the electrical conduction of the heart, and then the outcome of reducing the contractility and electrical conduction of the heart is going to be reduced heart rate. So if a patient is having tachycardia and he takes beta blockers, it's going to bring down the heart rate. And also, if the patient is having high blood pressure, hypertension, it's going to bring it down also. That is the duty of beta blockers. It also reduces renin release. Renin is released in the kidneys and it makes the blood pressure high. I've already done a video on that. It talks about how the kidneys regulate blood pressure. So I'll be leaving a link there to that video so that you can go there and watch it and understand how the kidneys regulate blood pressure. Comment antihypertensives if you've watched this video to this point. And if you've also watched this video to this point, do well to like this video and click on that subscribe button so that you don't miss out on any of my updates. I promise you that I've given you back-to-back updates on this channel. So you want to subscribe so that you don't miss out on any of those updates. Now, why do we administer beta blockers? Remember, we've already established the fact that beta blockers are antihypertensives. So the first indication of beta blockers that should come to your mind is hypertension. So if your patient is hypertensive, one of the drugs of choice to manage this hypertension is the beta blockers. We also have other indications like angina pectoris, myocardial infarction, heart failure, and glaucoma. In glaucoma, beta blockers like timolol are used to reduce the intraocular pressure. Comment glaucoma if you want me to talk about glaucoma in the next video. It just occurred to me that I've not given you the examples of beta blockers. Not to worry, I'll list them for you. But then, let me give you a cheat code on how to know beta blockers. Most of them end in lol. When I give you the examples, you're going to see it. We have metoprolol, propanolol, carvedilol, nadolol, nebivolol, timolol, etc. So many beta blockers that exist in the market. But let's just look at this one. Since I've given you the cheat code, anytime you see a beta blocker, you're going to identify it. But then, do not generalize based on a single cheat code, because there are some drugs that may have the same suffix but may not belong to the same class. Just as we have omeprazole as a proton pump inhibitor and apiprimazole as an antipsychotic. So make sure you don't generalize. Each time you see a new medication that has a cheat code, make sure that it conforms with that cheat code. Otherwise, you could be causing this for your patient. Now, the side effects. The side effects of this medication, remember, beta blockers are typical antihypertensives. So the first side effect that is going to come to your mind is hypotension. So you have to monitor your patient's blood pressure before giving this medication. If the systolic blood pressure is less than 100 millimeter mercury, please withhold any beta blocker. Don't give it at all because it's going to cause severe hypotension. Now, other side effects include bradycardia and also bronchoconstriction. Remember, if your patient is asthmatic, you want to reconsider beta blockers because one of the major side effects of beta blockers is the bronchoconstriction. So if your patient is asthmatic, it's a no-go area. It could cause severe bronchoconstriction. So it's better you avoid beta blockers. Find out other antihypertensives that work for the patient. There are also some side effects like insomnia and fatigue. So each time a patient is taking beta blockers, it's very important to educate them to report signs of fatigue and insomnia so that you can take the next line of action. Now, these are your key responsibilities as a nurse if your patient is taking any beta blocker. The first one, I've already said it before, withhold this medication if the patient's systolic blood pressure, that is the upper number, is less than 100 millimeter mercury. Withhold beta blockers because it could cause severe hypotension. Another thing is that if the patient's pulse is below 60 beats per minute, you also want to withhold this medication because it will cause severe bradycardia. Imagine when the patient's blood pressure is coming down and the heart rate is also coming down. That's cardiogenic shock. And this patient's life could be lost if there's no proper intervention. So prevention, they say, is better than cure. You also want to monitor for side effects like wheezing. When there's wheezing, it could mean that there is bronchoconstriction. So you want to withdraw this medication at this point and then look for ways to dilate this patient's airways so that the patient doesn't become hypoxic. And then there is another one I want to pinpoint here. Advise the patient not to stop the medication abruptly because it could cause rebound hypertension. That means it could make the hypertension come back and also cause severe myocardial infarction, that is heart attack. So if the patient wants to stop the medication, it has to be stopped gradually. The dosage has to be reduced until the patient can finally discontinue this medication. And again, there is another one I want you to take note of. Please do not co-administer beta blockers with calcium channel blockers because they could have an interaction and then cause severe hypotension. Calcium channel blockers like lisinopril and the rest, you don't want to administer them at the same time because it could cause severe hypotension and bradycardia. You can also see my video on calcium channel blockers after this one. It's going to help you understand antihypertensives. Let me know in the comment section if there's any other topic you want me to talk about and I'll do a video on that immediately.